Hi guys. So today we'll learn about the anterior aspects of the base of the skull, specifically the anterior cranial fossa. Now, the anterior of the base of the skull is also referred to as the intracranial cavity, which is the appearance of the base of the skull after removing the skull cap from inside. And so the floor of the cranial cavity is divided into three main parts. So as you can see from the diagram, it's divided into the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. So the cranial cavity is naturally demarcated into these three parts. So there's no need to draw any imaginary line. Now, these large depressions within the internal surface of the cranial base houses different parts of the brain and its associated structures. The anterior cranial fossa is the shallowest and the most superior cranial fossa. So let's begin by talking about the anterior cranial fossa, and this is going to be our guide. We'll look at the boundaries of the anterior cranial fossa, look at the floor of the anterior cranial fossa, we'll look at the features and some clinical significance of the anterior cranial fossa. So first of all, we want to look at the boundaries of the anterior cranial fossa. So anteriorly on each side, this side of the anterior cranial fossa is the frontal bone. So one on this side, on the other side is a frontal bone. So this is a frontal bone. This is a frontal bone. So anteriorly, on each side, we have the frontal bone. And posteriorly, we have the border, the lesser wing of sphenoid. So this is the lesser wing of sphenoid. So this is the posterior border, lesser wing of sphenoid. And also, when you look at the lesser wing of sphenoid, you can see some tooth-like projections from the lesser wing of sphenoid. Some tooth-like projections, one here, one on the other side. So this is called the anterior clinoid process. So it's more conspicuous in this diagram. So this is the lesser wing of sphenoid. This is the anterior clinoid process. Also, there's this sulcus that is found between the two anterior clinoid process. This sulcus here, where my pointer is called the sulcus chiasmaticus. The sulcus chiasmaticus, which is closely related to the crossing of the optic nerve, which is the optic chiasma. Now let's look at the floor of the anterior cranial fossa. Now, in looking at the median plane, that's the side, looking at the median plane, okay? When we look at the midline, we can see a sieve-like plate or a bone with many perforations within it. Now, this plate is referred to as the cribriform plate of the ethmoid bone. The cribriform plate of the ethmoid bone. Now, this cribriform plate forms the roof of the nasal cavity. Now, these perforations transmit the rootlets of the olfactory nerve, about 15 to 20 rootlets or filaments. Also, looking at the midline, you can see an upward-like tooth-like projection called the crystal gully. This is the crystal gully. So it's an upward projection, okay, called the crystal gully. Now, just anterior to the cribriform plate is a depression called the foramen cecum. Now, cecum comes from the Latin word cecus, which means blind. So foramen cecum, or the blind foramen. Now, occasionally, this foramen may be patent, and once this patent, it usually transmits the emissary vein. Now, also in the midline, there's an elevation of the frontal bone. So you see, this is the elevation of the frontal bone where my cursor is. Now, this is called the frontal crest. This is called the frontal crest. Now, the frontal crest together with the crystal gully provides attachment to the anterior part of the falx cerebri. Falx cerebri is a dura matter that separates the two cerebral hemispheres. Now, you can closely observe along the anterior border of the cribriform plate that there are some canals, okay, called the ethmoidal canal. So along the anterior aspect of the cribriform plate, we have the anterior ethmoidal canal. So that's here, anterior ethmoidal canal. And this canal transmits the anterior ethmoidal nerves and vessels. So the ethmoidal vein and then the ethmoidal artery. Also, or similarly, along the posterior aspect of the cribriform plate, you have the posterior ethmoidal canal, which also transmits the posterior ethmoidal vessels. Now, posterior to the cribriform plate, you find this smooth-like bone, okay, just from the posterior aspect of the cribriform plate, a smooth-like bone projecting all the way from the posterior aspect of the cribriform plate to this sulcus chiasmaticus. Now, this smooth-like bone is called the jugum sphenoidale. The jugum sphenoidale. So it's a smooth bony surface where the ethmoid bone articulates with the sphenoidal bone. Now, this sphenoidale is limited posteriorly by a sulcus, and this sulcus we described as the sulcus chiasmaticus. Now, let's look at the floor of the anterior cranial fossa. So on each side, so this is the orbital process of the frontal bone, and also you can see that we have the lesser wing of the sphenoid. So it also forms the floor of the anterior cranial fossa, the lesser wing of the sphenoid, It's important to note that the lesser wing of the sphenoid is related to a very important sphenoparietal sinus. It's a very important sinus called the sphenoparietal sinus, which usually drains into the cavernous sinus, or found at the anterior end of the cavernous sinus. Okay, so lesser wing of the sphenoid, we have the orbital process of the frontal bone, forming the floor of the anterior cranial fossa. You can also see some irregular depressions here, and these depressions are as a result of impressions formed by the gyri and the sulci of the cerebral hemispheres. So again, just to reiterate, we look at the features of the anterior cranial fossa. So we spoke about a sieve-like bone that has perforations within it that transmits olfactory rootlets or filament. We said about 15 to 20 of them. And we said that there's this elevation of the frontal bone called the frontal crest, which acts as a site of attachment for the falx cerebri. We also spoke about a depression here at the anterior aspect of the cribriform plate called the foramen cecum. We said that there are times that the foramen cecum is patent, and when it's patent, it transmits the emissary vein, which eventually drains into the superior sagittal sinus. So to continue with the features, there's a very important structure here called the anterior clinoid process, which is a tooth-like projection from the lesser wing of sphenoid. Anterior clinoid process. Now, this anterior clinoid process serves as an attachment for the tentorium cerebelli, which is also a sheet of dura mater that separates the cerebellum from the rest of the brain. So this is the tentorium cerebelli. Okay, it separates the cerebellum from the rest of the brain. Now, some clinical correlation. Now, we have the black eye. The black eye is the appearance of bruising around the eye. Okay, so when you have fracture of the anterior cranial fossa, it may cause bleeding and discharge of CSF through the nose, what we call CSF rhinorrhea, and blood may also seep into the eyelid. So you can see this is the area of the eyelid, this discoloration, black discoloration. This is what we call the black eye. So this is the clinical significance. Whenever you have fracture of the anterior cranial fossa, blood may seep into the eyelids to cause this black eye. Now, it's worth noting that the black eye would normally heal without any medical intervention. Thank you very much for your time, and I'll see you in the next video. Kindly like, share, and subscribe to my YouTube channel. Thank you.